What are the dangers of having a breast implant surgery? Well, in general, these surgeries are quite safe when they're done by safe surgeons in safe facilities with safe anesthesiologists in attendance and a safe surgical staff. But if these conditions are not met, people have died having breast augmentation, where they have been allowed to sleep to death, either in surgery with poor anesthesia, or improper anesthesia, or in the recovery they were ignored and simply slept to death or had drug reactions. There have been cases in surgery where the intercostal muscles have been perforated and the lung collapsed unrecognized, and this led to death after surgery, in recovery, or at home. We have not and never will have these occurrences in our facility, and facilities that are properly run do not have this sort of event, but it can occur. Other dangers down the road are much less significant, of course, but there can be infections in the early post-op period, and there have been reports of severe infections requiring hospitalization. After surgery, the area about the implant is a large pocket under a muscle, and at times within the first 5 days or so after surgery, bleeding can occur around an implant that results in a trip back to surgery and a night stay in the hospital. So things can happen. Now in the long term, there can be capsule contracture and firmness and asymmetry and pain around implants and breasts, and this can require additional surgery, implant change, or ultimately, at times, implant removal. There have been cases of nipples that totally lacked sensation, and even breasts that had no feeling whatsoever after breast augmentation. So be aware that while things generally go very well, nevertheless, at least 30% of people having breast implants will, in the first 10 years, for one reason or another, have those implants removed and replaced, removed, or the implants adjusted, or something of that nature. So think hard. In conclusion, learn all the facts, learn what your risks are, and if you feel that you still want to go ahead, fine. In reality, it is a very safe operation if it is done safely.